here has ever seen or read the 50 Shades of Grey series? Did you know that people could actually suffer from a mental disorder that carry out these acts? A facade is placed over the idea of sexual masochism as just a series of acts carried out in one's sexual fantasies or sex life. For many of us, the reading or viewing of erotica or the viewing of pornography is a healthy expression of human sexuality. However, there is a fine line where this act of pleasure can become a mental disorder where it damages one's ability to perform daily tasks. Sexual masochism disorder is a complex and often misunderstood condition. To better understand this condition, I will be discussing what sexual masochism is, what are the warning signs, its possible causes, and how it is treated. The practice of sexual masochism, according to medicine.net, as a disorder includes sexual fantasies and behaviors of being beaten, humiliated, or otherwise made to suffer in order to achieve their sexual climax, otherwise known as an orgasm. These individuals sometimes inflict pain on themselves by cutting, burning, or piercing their skin, or inflicting any type of pain with something as little as a hair tie in order to reach their climax. Many of these individuals will often seek out a partner who will enjoy inflicting pain on them, otherwise known as a sadist. Together, these partners will participate in bondage, spanking, whipping, or inducing a state of aphaxia. Aphaxiaphilia is commonly associated with sexual masochism, however, they do differ. This disorder is when the person reaches sexual climax by airway restriction or by choking or hanging. In today's culture, we describe this relationship as bondage, discipline, sadism, and masochism, also known as BDSM. However, the majority of these people are within consensual relationships and do not experience any sexual shame or guilt. These individuals experience masochism as a lifestyle choice or a game, not as a sexual deviance. Psychology Today states that individuals who are clinically diagnosed with this disorder experience severe anxiety, shame, guilt, or other obsessive compulsive thoughts regarding sexual masochism. The DSM-5 informs us that in order to be diagnosed, these symptoms must be recurrent over a 6-month period and must cause significant impairment to one's relationship, occupation, or social functioning. This does not include individuals who express masochistic interest. As long as the individual is able to perform daily tasks, accomplish goals, and keep healthy social relationships, they are not diagnosed with this disorder. According to the Merrick Manual, sexual masochism disorder is a practice of sexual masochism to the extent where it causes considerable suffering to the individual and interferes with their functioning on a daily basis. Causes and treatments for the disorder vary on each individual. There are no universal causes explaining the root of this mental disorder. However, according to Psychology Today, there are a few theories out there. One theory suggests that these thoughts and urges are suppressed and then they become stronger as they are forbidden. And once they're acted upon, the individual is in a constant state of arousal or a formed-in addiction. The second theory is that these people perform these acts as a form of escape. And then the third theory is that there has been childhood trauma that has manifested itself into this disorder. According to Theravibe.com, there is a medicinal treatment to depress hypersexual desires known as the Depo anti-androgen shot, which decreases one's libido. And another form of treatment is to undergo behavioral therapy. These patients will keep a diary of their sexual fantasies, masturbation, and arousals, and then discuss the contents with a therapist. Sexual masochism disorder is not classified as a freak in the sheets. However, it is a complex disorder that interferes with one's ability to live and perform a daily life. So today we have studied what sexual masochism disorder consists of, how it differs from masochistic practice, symptoms, possible causes, treatments, and diagnosed individuals. Sexual masochism can be a healthy practice in a couple's relationship. However, it is important to realize the fine line where this mindset can become detrimental to one's mental health.